Good day, class. My name is Ripley Martinez, and for my chosen disease, I have chosen alopecia mental retardation syndrome. The nature of this disease is composed of two conditions, one being alopecia, which is the loss of hair from the scalp or any part of the body. Alopecia is a condition usually caused by the immune system attacking hair follicles as it believes the hair to be an invader. There are different forms of alopecia: total, partial, patches of hair, as well as thinning of hair loss, to hair loss. The second condition of this disease is mental retardation syndrome, also called intellectual disability. The combination of both conditions creates alopecia mental retardation syndrome, also referred to as alopecia with severe intellectual deficit or alopecia intellectual deficit syndrome. It is a very rare recessive inheritance disorder in which affected individuals experience hair loss and mild to severe mental retardation. The exact cause or causes of the development of this disease are unknown. Severity depends on the individual. Signs and symptoms of this disease include hair loss, partial or total. This would depend on the severity, as mentioned. Hearing impairment, sensitivity to light, hypertonia, a condition that makes muscles feel weak, as also known as low muscle tone. Global developmental delay, such as behavioral issues, for example, delayed nonverbal communication, ADHD, social anxiety, and shyness. Physical features such as large ears, cross eyes, flat feet, long narrow face, low IQ. Dry skin is another symptom, as hair loss can be prone to skin conditions. Risk factors. The biggest risk factor is the non modifiable genetic inheritance. If the both parents have this disorder, it's most likely the son or daughter is going to also have this genetic disorder for both alopecia and mental retardation. Another risk factor is if a person already has an autoimmune disease, it can help trigger both or one disorder. Effects on the body, structural and functional. The first condition, alopecia, the effects are total hair loss, inflammation, suppression of hair growth, depression, and anxiety. Effects on the body and function of mental retardation syndrome includes developmental delays, intellectual disability, learning disability, behavioral changes, and structural deformities. Psychological changes associated with this disorder include abnormalities in brain development and function, which contribute to other effects and complications. Diagnosis specifically for alopecia would be a scalp biopsy, which can be conducted as a minor medical procedure that extracts an area of the skin and hair from the scalp. Also, a hair sample can be sent to the lab for testing. For both alopecia and mental retardation syndrome, a DNA or blood test can identify the autoimmune disorder or genetic inheritance. For the mental retardation syndrome, the FMR1 gene has been currently researched to be one of the causes of the condition. Specifically for mental retardation syndrome, some prenatal tests can be conducted. A healthcare provider can take a sample of the amniotic fluid or cells from the placenta for testing. Alopecia retardation syndrome cannot be prevented, but it can be managed. A few treatments include corticosteroids, which are anti inflammatory drugs, topic immunotherapy, where allergens are rubbed in the skin in order to create an allergic reaction, which then promotes hair growth. Gabapentin is used for seizures and mood stability. Phototherapy are ultraviolet light waves that help certain skin disorders. Melatonin for sleep issues, and sertraline, which addresses aggression or obsessive compulsive behavior. Living with alopecia mental retardation syndrome. A few things to consider depends on the severity of alopecia as well as the mental retardation. Some individuals may choose to wear makeup to minimize the hair loss, wear wigs, hats, scarves, extra accessories. An important thing to consider, however, is that individuals now have to replace the protective layer on top of the skin since there is no hair. For example, clothes to protect dust and debris, or even sunglasses to protect the eyes from the sun and the environment. Depending on the severity of the mental retardation syndrome, one may have to adapt to different learning styles and techniques, um, as well as actively and managing the treatment condition, as specified from the before slide. And nonetheless, a balanced diet would is always a good option to keep the body and mind healthy. In conclusion, here are my references, and I hope we all ended this class on a good note.